My name is Kelly Wolfe. I'm a pediatric neuropsychologist here at Children's Colorado, and I'm here to talk to you about a study called COMPASS Ancillary Neurodevelopmental Outcomes. This study is starting at Children's Colorado and other children's hospitals across the country in 2025. CAN-DO, as we call it, is an ancillary study to the COMPASS trial, which stands for Comparison of Shunt versus Stent. This trial has been ongoing through the Pediatric Heart Network, which is a network of over 40 children's hospitals in North America that involves comparing two different intervention approaches for newborns who are born with a type of congenital heart disease called ductal-dependent pulmonary blood flow. What this essentially means is that when these neonates are born, because of the shape and structure of their heart, the blood that is meant to go to the lungs to receive oxygen mixes with blood that has already received oxygen. And so they require a surgery in the newborn period to correct this defect. The COMPASS trial was born because historically this type of congenital heart disease was treated with open heart surgery using cardiopulmonary bypass to place a systemic to pulmonary artery shunt. This was a very invasive and long procedure with chest opening and sternal precautions afterwards, requiring a long neonatal hospital stay. More recently, some practices have been switching to trialing a ductal arterial stent to correct this type of congenital heart disease, which can be done via catheterization, avoiding the open heart surgery, avoiding bypass, and theoretically at least leading to a shorter hospital stay. The COMPASS trial is a randomized controlled trial comparing survival to 12 months of age, as well as other medical comorbidities such as days in the hospital during the first year of life, need for re-interventions, and other complications in patients undergoing the shunt versus the stent procedure to treat ductal-dependent pulmonary blood flow. Thankfully, as with many types of congenital heart disease, the surgical and catheterization outcomes are looking excellent, and so survival is thought to be strong in both groups, although the final results of this study remain to be seen. Because surgical outcomes have improved so much in the field of congenital heart disease over the past several decades, neurodevelopmental outcomes have become increasingly important. In fact, there are now more adults living with congenital heart disease than there are children, and neurodevelopmental challenges are the most common consequence of critical congenital heart disease across the lifespan. One of the most consistent predictors of neurodevelopmental difficulties is early surgeries using cardiopulmonary bypass, as well as the amount of time spent in the hospital during early life. A group of us, through the Cardiac Neurodevelopmental Outcome Collaborative, of which Children's Hospital Colorado is a founding member, got together to start to think about whether we could add neurodevelopmental outcomes as a further out evaluation of the COMPASS trial interventions that are being compared. We started to think about whether one procedure over the other, particularly the stent versus the shunt, might have some advantages for ultimate neurodevelopmental outcome, and whether that would be helpful information for families and cardiac surgery centers when choosing which intervention to recommend for a particular patient. So a group of us got together a couple of years ago and started putting together an idea for this study. We gathered preliminary data, including some data showing that in some samples of newborns undergoing surgery for congenital heart disease with bypass, before and after their surgery, we see increases in biomarkers of neural injury, which may be related to some of the neurodevelopmental challenges that we see later. We also gathered our own preliminary data here at Children's Colorado that showed differences in biomarkers of long-term neural development or brain development in our critical congenital heart disease population that was also related to toddler age neurodevelopmental outcomes. So taken together, we think that there is likely an interaction between abnormal neural development that may proceed kind of across childhood and adolescence in this population, as well as acute neural injury that we hypothesize may be more significant in children undergoing the shunt procedure with cardiopulmonary bypass. This is unknown, however, because no studies have looked at these biomarkers before and after a catheterization procedure. Taking a step back, the overall aim of our study is to compare 3-year-old neurodevelopmental outcomes in children who undergo the shunt procedure versus the stent procedure to treat neonatal ductal-dependent pulmonary blood flow. We are going to accomplish this across 21 children's hospitals across the United States and Canada, with Children's Colorado serving as the lead center. We are also going to take blood samples before and after the neonatal procedure, whether it is the shunt or the stent, and look at those biomarkers of neural injury, as well as those longer-term biomarkers of neural development, with one more blood sample being taken in conjunction with a clinical blood sample around 3 years of age. One of the reasons that we think it is so important to go upstream from neural development and look at biomarkers is because we know that developmental interventions can be very effective, but also have to be very intensive and take a lot of resources, commitment from families, as well as developmental professionals, and simply time. What we hope is that by better understanding early biomarkers of neurodevelopmental risk, we can educate providers as well as families of patients about the need for intensive developmental therapies and help to triage patients who need them the most to the highest level of intervention. We also hope that this research will help inform individualized, personalized medicine strategies for neuroprotection so that we could potentially avoid some of this neural injury during medical treatment that is necessary for children with congenital heart disease. This ancillary study is also being conducted through the Pediatric Heart Network and will leverage multiple clinical registries so that we can leverage data use agreements and infrastructure that's already in place to help with the lift of this multi-site study. We have children's hospitals across the United States and Canada that will be recruiting and participating in both the biomarkers as well as the neurodevelopmental assessment pieces of this study. And we hope that by doing this study even more broadly beyond the findings, that we will continue to establish a precedent for neurodevelopmental outcomes to be considered as a key outcome in future clinical trials for children with congenital heart disease. So we hope this study will be up and recruiting beginning in 2025 and will last for about 5 years for the course of the grant. If you have any questions, please feel free to reach out. Thank you.